I'm now going to demonstrate sinuses. We're going to do the 4 images with the board when the board will angle, so we keep that beam horizontal throughout the study. Again, first thing we do with the patient in the room with us is we're going to wipe down the board so the patient knows that the board is clean prior to placing their head against the board. The image receptor is already in the bucky tray, 10 by 12 lengthwise. And I will move the patient into the board. I'm going to do a right lateral to demonstrate the positioning. Typically I would normally do a left lateral, but we will do the right lateral so everyone can see. And your center ray for the lateral goes 1 inch posterior to the outer canthus. Okay, I'm going to move the board a little. Remember to tell your patient because I don't want to hit the patient. We're going to place the right marker in the light field. You can do on the image receptor or in the light field. And we can also collimate slightly. There's your lateral sinuses, 1 inch posterior to the outer canthus. The interpupillary line is perpendicular to the IR. The next picture we're going to do is the waters, because we don't have to angle the board yet. Remember the sinuses, the most important thing is the horizontal beam. I'm going to turn the patient, have them place their chin up on the board. The MML should be perpendicular. I'm going to switch the marker. This is their PA. We would switch out the image receptor as well. Our center ray is going to go through, exit the acanthion. So again, we're going to find the line. I'm going to move the board up slightly. Good. Again, always tell your patient what you're doing. All right. I'm going to move the board slightly to center up to the eye bar. Behind the patient, make sure they're nice and straight, right in the middle. All right, that's good. And I'm going to make sure the bucky tray is centered as well. Move it up slightly. Good. Okay, there's your waters. So now I'm going to back the patient off a little bit because I am going to angle the board this time for this next image. We're going to do a PA axial. We're going to angle the board approximately 15 degrees. Once we've angled the board, we're going to now place the patient against the board and with their nose and forehead on the board. Good. Center ray is going to exit the nasion, so again, I will move the board up slightly. Good, perfect. And notice the horizontal beam. Again, you want to keep that beam horizontal for sinuses to show the true air fluid levels. Make sure the patient's nice and straight in the middle. We have a right marker over here in the light field. There is your PA Caldwell, PA axial for sinuses with the board angled 15 degrees down. The next one we're going to do, I'm going to move the patient back again because now I'm going to angle the board approximately 20 degrees down. Now for this one I'm going to use a paper towel to place on the board because I'm going to have the patient now open their mouth and place it right on the paper towel. Perfect. This line now needs to go right through the level of the lips. So I'm going to let my patient know I'm going to move the board down a little tiny bit, not a lot. Good. Perfect. Center my tube. And move the patient so they are right in the middle and straight. And there would be our period transoral projection, open mouth. If you recall, if the board doesn't angle, we did an open mouth waters for this. Also, when we did the PA Caldwell without the board angling, remember we backed the head off about 1 inch and just the tip of the nose was touching the board. But again, the beam stays horizontal. You never angle the tube for sinuses to show true air fluid levels. Tell your patient to relax. All right. And that would be sinuses with the board